Hello students, myself Dr. Maddineni Srinivas, your dermatology faculty in Cerebellum Academy, and in this video we are going to see FMGE June 2022 Dermatology MCQs. So this is your first question. Which of the following is a causative agent of acne fulminans? So remember, acne fulminans is a severe form of acne which is also called as acne maligna, and just like acne vulgaris, the causative organism is propionibacterium, which is now being also referred to as Cutibacterium acnes. And in this, the patients are going to present with hemorrhagic and ulcerative nodules over the face, back, and the trunk. And apart from this, they are also going to have some constitutional symptoms in the form of fever, malaise, and arthralgia. So this is the classical features of the acne fulminans or acne maligna. And remember, the clue which examiner might give you in the question is antimicrobial treatment, which is going to be a failure in the patients of acne. So this is a very important clue. And in this picture, you are able to see there are ulcerative nodules present over the body. So this is the next question. A 25-year-old pregnant female presents to the dermatology OPD with the given condition, and in the picture you are able to see hyperpigmented, mainly brownish pigmented patches present over the cheek. And whenever you see this kind of a lesion, always think about melasma. But in pregnant woman, if melasma is seen, it is called as chloasma. So the answer here is option number D. And why is it not SLE? Because in SLE, the rash which is present over the cheeks is going to be red in color, but not brown or black. And likewise in rosacea also, the color is going to be red. It is also associated with the presence of papules and pustules in the case of rosacea. Okay, so because we are not able to see all those lesions, the answer here is going to be chloasma. The answer is chloasma. Which all of the following shows Keebner's phenomenon except. So the answer is herpes. And I hope you all do remember Keebner's phenomenon is also called as Koebner's or Keebner's isomorphic phenomenon. Isomorphic phenomenon, and the examples for this you can easily remember with the help of this mnemonic. PSLV, which is Polar Satellite Launching Vehicle in terms of space shuttles, but for us, PS is psoriasis, L is lichen planus, and V is vitiligo. And you must know that if there is a trauma in the patients of psoriasis or lichen planus or vitiligo, then along the lines of the trauma, there is going to be the development of the similar looking lesions in all these patients. And because the underlying mechanism is autoimmunity, these lesions are referred to as true Koebner's phenomenon. Whereas there is another Koebner's phenomenon which is referred to as false Koebner's phenomenon, in which we have the important examples of the warts and the molluscum contagiosum. Warts which are caused by human papilloma virus, and molluscum contagiosum produced by the pox virus. So in these two conditions, due to auto inoculation of the infectious material, similar looking lesions are going to be seen over the body. Okay. The next question is identify the type of psoriasis in the given picture. And in the given picture, what you are able to see, predominantly small erythematous papules, which are looking like raindrops are present over the body. Whenever you see this raindrop pattern, remember guttate is the term which you should remember about. And this is a special type of psoriasis called as guttate psoriasis, which is mainly associated with group A beta hemolytic streptococcus. And because it is associated with a bacteria, the treatment here is going to be antibacterial, and mainly we are going to prescribe the macrolides. We're going to prescribe macrolides. And how does erythrodermic psoriasis present? The patients are going to have the skin involvement of more than 90% of the body surface area, which will become erythematous, and there will be also scaling. Whereas in pustular psoriasis, there are going to be sterile pustules present almost all over the body or entire body. There are going to be pustules which are present. And in the case of inverse psoriasis, please remember inverse psoriasis is also called as flexural psoriasis, where erythematous patches are going to be present in the flexures, mainly in the axilla, in the groin, and also inframammary areas. And the important feature of this psoriasis is that scaling will be absent in this inverse psoriasis. Scaling is absent. Okay, this is about this MCQ. So what is used to diagnose the condition which is shown below? And in the image, if you observe closely, you are able to see hypopigmented macules. Small hypopigmented macules are present, and they are also coalescing with each other to form large patches. If you see this kind of lesion, hypopigmented or even hyperpigmented lesion, which is associated with furfuraceous scaling, always you must think about P. versicolor. Always you must think about P. versicolor, which is produced by Malassezia globosa and Malassezia furfur. And in this, I hope you all do remember that we can perform an investigation which is called as potassium hydroxide, in which we are going to see spaghetti and meatball appearance. Spaghetti and meatball appearance. But in the options, you are able to see that KOH is not mentioned. So please remember Wood's lamp examination is going to help us in diagnosing this P. versicolor, which is going to show a yellow colored fluorescence. A yellow fluorescence can be seen. And you might be wondering why culture is not the answer. Please remember, Malassezia requires lipid for its growth. It's not some normal media which we can use for the growth. We need to add some oil. So because it's a specialized uh, investigation, so culture here is not the answer, and Gramston is going to detect the bacterium, but here the cause is due to a fungus. Patch test is used for allergic contact dermatitis, and it has no role in the fungal infection. So the answer is going to be option number B, where you are going to see this kind of a very mild yellow fluorescence. Okay. And this is the next question. A 26-year-old male presented with a skin lesion, as you are able to see over the elbow. And what is the skin lesion you are able to see? There is a erythematous plaque which is having silvery scaling, silvery white scaling. And also the question says that biopsy shows the presence of multiple neutrophilic foci in the stratum corneum. What is the most likely diagnosis? So very easy. You have got so many clues. The answer is option A, which is psoriasis. But what are these neutrophilic foci which are present in the stratum corneum of the patients of psoriasis? So they are called as Munro's microabscess. So they are referred to as Munro's microabscess. Briefly about the histopath of psoriasis, which is very important. So in the stratum corneum, there is going to be a thickened stratum corneum, which is called as hyperkeratosis. There is going to be persistence of the nucleus in the stratum corneum, which is parakeratosis. And yes, there is collection of the neutrophils, which is referred to as Munro's microabscess, which you are able to see in this image. In the granulosum, remember, the granulosum is completely absent or reduced in thickness in the patients of psoriasis. And in the stratum spinosum, remember, there is going to be a regular elongation, thickening of the stratum spinosum. And in the stratum spinosum, there is one more named thing which you must remember, which is collection of the neutrophils, which is referred to as spongiform pustules of Kogoch. Spongiform pustules of Kogoch, which you are able to see in this image of the psoriasis patient. Okay, so these are some of the important histopathological named features which you are going to remember. Very important. So that's it, students. Thank you so much.